Well, I would like to introduce you guys to Dr. Jennifer Gander. She's an epidemiologist for health outcomes research and is committed to a career in clinical and translational research. Dr. Gander's focus is to improve health outcomes for patients diagnosed with chronic diseases. More specifically, Dr. Gander's emphasis is to improve health outcomes for patients diagnosed with chronic kidney disease and end-stage renal disease. Dr. Gander's current work focuses on talking with patients to understand their experiences with managing kidney disease and working with the nephrology team to improve patient education and reduce barriers in their care. Dr. Gander continues her translational research at Kaiser Permanente, Georgia. And please give a warm welcome to Dr. Gander.
All right. Good morning, everyone.
Good morning.
Can I please get a big round of applause for Rebecca and the Georgia Transplant? They have been absolutely wonderful putting together this Trends in Transplant. As a supporter for over a decade of Georgia Transplant Foundation, it's so great to see everyone in person as well as virtually. So I also wanted everyone to give each other a round of applause. That's amazing. Each one of you all in person as well as virtually, we all overcame challenges, right, to get here this morning, whether it was traffic, internet connections, the Zoom link working and not working. Like, thank you all for coming. As Rebecca introduced me, thank you so much for that warm welcome. I am a clinical epidemiologist and have about, knowing the audience of this, the presentation this morning will be about an inch deep and a mile wide, right? So I'm a PhD epidemiologist. I am not the doctor that will save you on an airplane if you get sick. I will not raise my hand, I promise. But I think my epidemiology card would get revoked if I didn't start this presentation with a few numbers, right? So I did want us to go over just what transplant looks like these days, right? So compared to 2010, we can see that the number of transplantations across the board keeps increasing, right? So we can see that kidney transplants have increased by 44%, liver transplants by 47%, heart by 63%, and lung by 42%. Basically, the line graph on the bottom, it doesn't matter if you can see the numbers, the lines are going up, right? Or at the very least, kind of remaining stable across the years. Some of the numbers and the data that I pulled from UNOS and this SRTR, so Scientific Registry for Transplant Recipients, some of the numbers that they put together on this infographic walk through why we keep seeing the numbers of transplant go up, right? So one of the things that I like to point out is for the solution. So we have had over 20,000 donors in 2021. And on average from those donors, and that's living and deceased, and so on average from those donors, they've been able to receive about 2.9 organs from each of the deceased donors that in 2021. And so what that's led to, between living and deceased donors, we've had over 40,000 transplants in 2021. Now, this is national data, nationally collected data, and that's why you see the 2-year timeline, right? Because it takes a while to get all this data together. But we're on a really good trend, right? Better up than down for this. All that to say, transplantation is not easy, right? I know a lot of us, just from a show of hands, I know we did this a little bit this morning with Rita. How many people have received a transplant? So they are post-transplant. And how many people are trying to get there? And how many people in this room or virtually are trying to help people get there and stay there, whether they are a caregiver, a nurse, a social worker, a dietitian, a doctor, and most importantly, a caregiver, right? Does this kind of look like what it feels like, right? The process to transplant is like a ready, set, run. It is a tough, convoluted, curvy, challenging, frustrating road. It's like starting in, I did a lot of my education, and a lot of my colleagues are in South Carolina, right? So it's like starting in South Carolina, in Charleston, South Carolina, and wanting to make it over to Seattle. Doing a cross-country road trip. Y'all can pick whatever car, bike, moped you want to do this in. It doesn't matter if it's a brand new car or a 1996 Volvo. It's a tough trip regardless. You have no idea what's going to happen along the way. You don't know if you're going to run out of gas, if your tire is going to fall off, if your car is just going to decide not to start one day. It is a really, really tough process to get to transplant and then even beyond. You can tell on this graphic, I didn't even go past transplant, right? I just put a rocket ship because, who knows? It's like going into outer space after you get a transplant. So what do we do, right? Should we just not go on the cross-country road trip? Should we just not even start this? And once you get your transplant, is that it? I was in the kidney transplant breakout session with Dr. K. I almost said Dr. You should be coming. I was in the kidney breakout session with Dr. K. And the patients in that group asked really good questions. Some were trying to get to transplant. Others were trying to figure out how to keep their transplant the longest and the best way. It always seems to be a shoulder shrug. So what I want to do, again, with this talk being to a whole bunch of different people and different experiences in the room, I want to keep it, again, inch deep, mile wide. So I think the very first step is to find your community. And I want us to all look around the room right now, and we have the individuals online. Like, this is part of it, right? Georgia Transplant Foundation, other members and community members that support the Georgia Transplant Foundation. That's part of the community. Coming here today is part of your community. You can start more proximal, right? More close to your chest, and it can be a caregiver. It can be a partner of 30 years that might go to every doctor's appointment with you, feverishly taking notes and recording every session because those doctors talk fast. It can be family and friends that are also there with you or can give you rides to those appointments, right? Rides to all of the different screenings that they want you to do for the evaluation process. It can be neighbors, church members, friends of like family friends that help you out, right? It could be that neighbor that you wave to every evening on your walk around the block, whose name might be like John or Adam, or maybe it was Jerry. Either way, we've waved way too many nights. I can't say his name now. Don't want to get that wrong. But even they are part of your community. Even John or Adam or Jerry or whatever their name is looks friendly. They can bring you a meal one night because cooking, it gets tired, right? And then you have a little bit more further out, a little bit more distant, a little bit more distal. And I think that's really like the transplant center, the transplant doctors, the transplant healthcare team, as well as just your healthcare team in general, right? They've got a lot of knowledge. They care for you. Like, as a human being, they care for you. That's why they're in this field. And they're a part of that community too. But you gotta start there because like we saw with that map, this road trip is long and curvy and bumpy and doesn't really seem to end. Because once you get to Seattle, you touch the base and you turn around and you go back, right? And that's what that's what living with a transplant is, because it's always changing. It's always some challenge. So let's talk about this community a little bit. And within talking about the community, let's talk about forming that healthcare team. So what does that healthcare team look like? I was able to listen to a lot of really good questions for the transplant nephrologist in the room earlier today. And everyone has come into your life, right, for a reason. Some stay longer than others, some go, that's fine. But forming that healthcare team, you really need to look at the comprehensive approach. So just like we were talking about the community, and there are a lot of different members and a lot of different individuals of various ages in that community, it's the same makeup for your healthcare team. So you should have a lot of different people in that system making up your healthcare team. And notice how I didn't see it. I didn't necessarily say ND, right? And so I'm talking about not just doctors, but also the nurses, the social workers that are there, the dietitians, the licensed therapists that are there for the vent sessions and the frustration, right, to help you get through this. And so not only do you build this healthcare team, and it should be comprehensive, you also at various points of time should think about who on your healthcare team, I'll use the sports analogy of football, like who's the quarterback, right? Who is the best person that you can communicate to at that point in time, who either knows the answer to your question or knows how to get a hold of someone to answer that question. And just as important as that, know how to communicate with them, right? So for those in the room and those virtual who are on their way to get a transplant, right? A lot of transplant centers, and it varies center to center, a lot of transplant centers have a pre-transplant coordinator, right? Like they are typically your quarterback. They are the ones who, if you have questions about what screening do you need a dental exam that, Rebecca brought up earlier? What are all of the ways and all of the steps in the evaluation process to get on the waiting list, if that is your goal, right? They're usually the ones to answer that. Once you're on the waiting list, they're usually the ones to help you stay healthy and stay active and remain active on that waiting list. Some transplant coordinators are always by their phone. Wonderful people will answer the most random, like probably the nicest people to telemarketers, right? Because they answer all of the calls. So phone would be a great way to communicate with them. Others are super quick with the texting, right? So texting is a really good way. Emails is another communication. So it's a part of this dynamic. It's trying to figure out who is on your team, but then how do they want to get, like, what's the best way? What's the most efficient way to communicate back and forth with them? And don't get discouraged. Try many different ways of communicating. And as many of us discussed, I know probably within everyone's breakout session, but I know we did in kidney, just as you think you figured out your healthcare team, it changes, right?
Yeah.
It looks very different as you're starting the transplant process and starting getting worked up for transplant as when you are maybe on the list and waiting for a transplant, and then you get transplanted. And then it's almost like that first year, you're in an orbit of yourself. Like, again, that's why I used the rocket. I didn't even try and do a roadmap, because then that first year, right, you're working closely with a transplant pharmacist. The regimen of medication keeps changing. So you move a lot of times, right, in your healthcare journey, you start with your primary care physician, right? He or she is the one that you've been going to for years. They noticed something was a little off and they might have sent you to a specialist, right? So that could be a hepatologist, a nephrologist, a cardiologist, some pulmonologist, one of those ologists, right? And then as they continue to care for you, they might have sent you on to a transplant provider, right? So as we saw, it was a transplant nephrologist or a transplant hepatologist, transplant cardiologist, right? That can speak more specifically to the transplant journey. And then from that, if they work you up, it's a transplant surgeon. They're really great about talking about surgery and the risk factors and immunosuppression drugs. You might circle back again with your transplant specific provider, right, with a transplant nephrologist who after transplant is going to get you through and make sure that the kidney that you worked really hard for you're going to keep it for as long as you can keep it. You work with a transplant pharmacist as well, and then eventually, maybe, depending on the transplant center and your primary care and your specialty team, you might get released back to the vital, right? You might get put back and released under the care of your primary care physician, so they can help maintain your transplant as well as the rest of your health, right? Because there's other things besides that organ going on. Or you might just hang out with all of these folks for the rest of your life. It's really dependent. It's dependent on, your current healthcare provider. It's dependent on the transplant center that you're working with. Every center is a little different, but it's good to know this. It's good to know that you've got to have a comprehensive team. And just expect that comprehensive team is going to change. And you want it to change because you want to make sure that the experts are always in your life, front and center, as part of that community. And that's also what your community at large should help you with, right? Help you navigate, help you make all of the appointments or the text messages or the emails or the phone calls. And so once you've got that healthcare team formed, communication, right, is so big. So I don't know if everyone in the room will recognize this reference, but have you all seen like the I Love Lucy? Do you all remember about the I Love Lucy episode where Lucy and Ethel are in the chocolate factory and they got the conveyor belt?
Yeah.
And it seemed easy at first, right? It seemed pretty easy. They were keeping up with the pace, but then towards the end, it was too much. It was like drinking from a fire hose. They started stuffing chocolate places everywhere. And if you only had one person on your healthcare team, that's what it would feel like, right? If you only had one person on your care team, for them, it would feel like they were Lucy and Ethel in that chocolate factory, that there were all these different questions and issues and, you know, this medication or that medication, and, you know, now a new diagnosis of diabetes, like all of these different things to manage that can be overwhelming. And so that's why communication is key, because you know who does know all of that? You and your caregivers and your community, you're the ones who know everything that's going on with you. You know how you feel. You know how you feel today versus how you felt a week ago versus 2 months ago, right? The healthcare team, as wonderful as they are, they're not going to know everything, and they can't act alone. So it's all about speaking up and speaking out. You've got to communicate to your care team what is going on. And they might not know your current challenges, right? They might not have any idea. Again, I do have more of a specialty in kidney. But they might not have any idea your urine output, right? Or my kidney patients, we love talking about urine and urine output. They might not have any idea that you feel like it's changed over the past couple, of months. But that's something that you can communicate to. And like Dr. K said earlier, they can follow up with, right? They can follow up with different tests or scans or imaging. You gotta ask questions. If we don't ask, we don't know. Transplant, compared to other conditions, transplant's amazing because it's one, and this was brought up earlier, I almost feel like they are some of the biggest pioneers in the medical field, right? I mean, years ago, two guys were like, hey, what if we take this kidney from this patient and put it in this one? And that was how the field of transplantation was formed, right? And since then, we've all seen it on the news, all of the different things these crazy transplant scientists are trying out, right? Like we talked about pig kidney transplants earlier this morning, right? Like that's where we are. So, but how would we know that if someone didn't ask that question, right? How would we know about all these different medications that might help prevent weight loss that we're seeing come out in the news? We're seeing celebrities use them. Do they work for transplant candidates? Do they work for people who want to try and get on the transplant list, have been told by their doctor they need to lose a bit of weight? Do they work for transplant recipients? What's the interactions between the drugs I'm currently on and these new drugs? Like, I don't know. But until you ask those questions to your doctor, you won't figure that out. And sometimes, especially with how quick some of the medical field is moving, especially in the field of transplantation, sometimes the doctors don't even know the answer, right? But they don't know that they don't know the answer until you put them on the spot and you ask them, and they're like, oh, that's actually a really good question. How would we deal with that? And they're inquisitive enough to know. They'll figure it out. And always, what I can't stress enough, don't always take your first answer. Right. So as we've kind of heard, and as I know a lot of people in this room understand, is that there's a lot of differences in one, like the healthcare, that path, that roadmap to transplant looks very different for everyone in this room, right? And the road after transplant looks different, as it should, right? We're all different people. We all got here for a different reason. So it should look different, but sometimes your care team might forget that. And so you want to make sure the best advocate for yourself is you, as well as part of your community, right? A lot of times, and I'm not going to bore you with the research, but and even as Rebecca was talking about before with living donor programs, like it's almost easier to advocate for somebody else than it is for yourself, right? I mean, research has shown I'm faster to go around and ask for $10 for you, right? You need $10. I'm happy to ask everybody else than you are yourself to ask for $10. It's so much easier to advocate for others. So ask questions, be your advocate. Get someone like me who's loudmouth to be your advocate for you if you don't want to do it, happy to do it. And then, and so keep asking questions and don't always take that first answer, right? Especially if something doesn't feel right about it. And it's always good in this long road trip across the country to just think about what are your needs? Like you are the patient, right? So as you're on this transplant journey to get a transplant or to once you've gotten it to keep it, what are your needs? What are your needs immediately? Maybe it's making your daughter's high school graduation. Maybe it's walking your son down the aisle in his wedding. Like, what are your immediate needs? What are your short-term goals? And what are your long-term goals? Because on this roadmap to transplant and beyond, when you get launched into space afterwards, it's really easy to get lost in the day-to-day frustrations, the challenges, the appointments that get pushed back, the emails of your questions that don't seem to get answered or not to your point. So don't lose focus of your why. Figure out your why, figure out your why for tomorrow, figure out your goal for next month, figure out your goal for December of this year, figure out your goal for 5 years. And try not to lose sight of it because it's a challenging road and it's easy to do so. And again, always, like I said, it's your community that should help you with that, right? Not only encourage you along the way, be your loudmouth advocate along the way, but then also just be that shoulder when, it's been a long day. Or maybe this road trip is done. Maybe it's enough. Like, and that's okay. They should be the advocate alongside with you. And if that wasn't enough, right? So we have find your community. We have form your healthcare team. Make it as comprehensive as possible. Once you have your healthcare team, speak up, speak out, be loud, be obnoxious. I love the squeaky wheel, as you can tell. I love the squeaky wheel analogy, right? It's the squeaky wheel that gets the grease. And also be a lifelong learner. So as we just kind of talked about, and as we've seen in the news, transplantation is one of the fastest changing fields, right? Things are changing all the time. So say with policies, right? In the past 15 years, policies at a national level have changed to try and improve allocation, to try and improve access to those deceased donor organs. Medication and medical technology has changed, right? There have been, decades ago, we didn't have dialysis to try and bridge someone to kidney transplant. Now we're seeing this innovation in the field of heart transplantation, right? Where a lot of these devices, LVADs, are being used to bridge people to transplant, which is fantastic. A few years ago, living donation in liver wasn't even thought of, right? And that's what come into play. Now in kidney, we're talking about transplanting pigs. We're talking about all these different types of medication. Post-transplant, we're talking about these different immunosuppression drugs. For living donor, we've been talking about, especially for kidney, the paired kidney donor exchange, right? Some mathematician somewhere created this algorithm that helped, if I need a kidney and I have a living donor and they're not a match for whatever science, right? For whatever reason, they're not a good match for me. I can still give a living donor if I participate through this paired kidney exchange program. That didn't exist 15 years ago. That was because somebody had a kid who needed a kidney and got really put out by not being able to find his kid a kidney. When you're upset and you're impassioned, you will find a way, right? Just like everyone sitting in this room and virtually. But you've got to do the continuing education. There's so many resources out there that are available, transplant specific, healthy living specific. kidney, like donor organ specific, and these are just a few. We all know, as we saw Rebecca do a wonderful job presenting this morning, Georgia Transplant Foundation has so many resources. I just put their link here. You all can find it. Like, they have so many resources. They have financial assistance. They have educational programs, mentoring programs, many, many, many different resources, not just educational that you can peruse online, but also just contact them and sign up for. UNOS, the United Network of Organ Sharing, also has a lot of resources for patients, as well as, I can't stress this enough, caregivers, right? Caregivers have to be, they've got to give themselves some grace. They've got to give themselves some breathing room. So some of the caregiving support is around, like, Be the Match, right? Like, go onto the website. There's tons of this information. That's why I just wanted to put the websites themselves. Healthy diet. I know later today we're going to have a dietitian come in specifically to speak about transplant. A lot of these things, and transplant related diet, a lot of these things also, like on the CDC dietary guidelines, you can find healthy substitutions, right, to lower your sodium if you need to. And then one of my favorite things that I learned about earlier this week is a healthy living website put out by the Million Hearts campaign from the CDC. It's called Live to the Beat. So Live to the Beat, I encourage everyone to go on. Live to the Beat is this incredible campaign, mainly to, like, get people moving, right? Get people dancing. It's like a fun Pilates class you can do in your house, and I don't have to worry about people watching me fall over myself. Live to the Beat is an absolutely incredible, comprehensive website that was designed for patients, by patients. I will say this was specifically around hypertension and lowering blood pressure numbers. But we all know that lowering blood pressure and addressing hypertension, which is one of the major risk factors of a lot of reasons people need a transplant, is really important. And getting moving can help all of us, right? So these are just a small minutia of resources out there to help us all be continued lifelong learners. And what I want to end with is the importance of check-ins, right? So think back to that roadmap I started with, and that long journey from Charleston to Seattle. And then you got to get there, and you got to turn around, and you got to come back. You got to keep checking in with yourself. You know, you got to keep checking in with your car or your moped or whatever you decided to ride on this cross-country journey with. You've got to do those self-check-ins because this is a tough process. And there's not a right or wrong way to do this, and there's not necessarily a right or wrong way to win. There is no win. Winning is an improved quality of life. Winning is living the way you want to live. So keep doing those check-ins. Check in with yourself, check in with your family and friends, right? So there are some times that the person who knows us best might be sitting beside us, right? I'm looking at you, caregivers. Like, it might be the person sitting beside you. So check in with them. And also check in with those caregivers and those family and friends that have been with you at every appointment to see how they're doing, right? There's too much resources and research out there showing just the burnout of caregivers. And do you know what I like the most? I like for the caregivers to have a caregiver, right? Like, if there's a spouse, right? Like, don't we all? I love that. Like, if there is a spouse who's doing a lot of the caregiving, who's going to the appointments a lot of the time, who's taking all of the notes, who might be making a lot of the appointments, who, as a caregiver, who is your caregiver, right? Who's going to porch drop you wine so you can decompress at the end of the night? Who is going to take you out and let you watch your favorite sports team win while you just vent about the week that you have had? Like, caregivers need to find their caregivers as well. Keep checking in. I can't stress this enough, and we've already talked about it. Keep checking in with your healthcare team. Things are changing all the time. If you would have asked me 2 years ago if I thought like Wegovy or Ozempic would have been even possible for weight loss, let alone transplant candidates or transplant recipients, I don't know if I knew what Wegovy was 2 years ago. So you got it, like, it is a fast-paced, changing world in transplant pre and post. keep checking in, keep asking questions of your healthcare team. They might not think to tell you something, not because they're trying to withhold information, it's just because they're Ethel and Lucy on the conveyor belt and they're just trying to take care of all of the patients as best as possible. And keep checking in with the healthcare system. Like I said, it's not just the medical technology and the treatments that are changing. Policies change all the time. Policies change, maybe not as often as you want them to, but policies do change, sometimes for the better, sometimes not. Healthcare systems change, workflows change. Who handles the pre-transplant workup and the post-transplant workup can change. When you get what they call repatriated, like handed back from the transplant center to your primary care team, that can change as well. That can change over time and that can change center to center. We saw in the prior like kidney breakout group, we even saw like a difference in transplant centers and post-transplant immunosuppressions, right? Some transplant centers use drug X, some transplant centers use drug Y. Not necessarily saying that one is better than another. Maybe it's better suited for some patients than others, but it changes, right? So keep checking in with the healthcare system. And as my last slide, and just a reminder, like never underestimate the importance of small steps, right? This, all of this stuff didn't happen overnight. It's a lot pre-transplant to think of getting worked through the evaluation process. It's a lot of people you're going to meet. It's a lot of people you're going to talk to. It's a lot of words and things that you're going to have to learn that you never knew existed. But it's a small step, right? And post-transplant is that same way. So think of it as almost like a training program, right? Like you're training yourself to not only get through the process to transplant, but then after, that level of advocacy and empowerment that you got through the process, you got to keep it up. You got to keep asking those questions. You got to keep talking to your pharmacist. You got to stay on top of those changes. But small steps really can make a difference. So I want to thank you all so much for coming out, reaching out to your community, right? Being a part of this community. And I'm happy to try and answer any of your questions. And if not, I will be the person who will find the answer and get it back to you. So thank you all so much. I appreciate your time.